The promise of erasing joint pain in 5 minutes with a forgotten stretch sounds almost too good to be true, doesn't it? Especially for those over 50 who feel like every morning brings new discomfort, new stiffness. This joint pain, which can range from mild discomfort to severe limitation, is one of the most common health problems in our age group. According to World Health Organization data, millions of people worldwide live with chronic joint pain, affecting their quality of life, mobility, and even mood. We often resort to quick fixes, like painkillers, which only mask the symptom without treating the root cause of the problem. But what if the cause isn't always cartilage, wear, or severe inflammation? What if, in many cases, the origin of the pain lies in a component of our body that is often overlooked by both us and conventional approaches? This is where modern science is beginning to illuminate a different path. Recent studies on connective tissue and the neuromuscular system are revealing that stiffness and pain can actually be a sign of failed communication between our muscles and our brain. If you are looking for reliable and safe information to improve your well-being, consider subscribing to our channel and activating notifications. What we will explore today is not a magic pill, but a fascinating evidence-based technique that can indeed bring noticeable relief in a few minutes by retraining your body. But how exactly could a simple stretch have such a profound and rapid effect? The answer lies in understanding the structure that connects everything. The key to understanding how such rapid relief is possible lies not in the bone or cartilage itself, but in the complex network that envelops every muscle, bone, and organ in our body, the fascia. Imagine fascia as a kind of internal wetsuit, a three-dimensional web of connective tissue that runs from head to toe without interruption. When we are young and active, this web is flexible, hydrated, and glides smoothly, allowing for free, pain-free movement. However, over the years, factors such as a sedentary lifestyle, poor posture, old injuries, and even chronic stress can cause this fascia to become dehydrated, stiff, and adhered. Think of it like a shirt that, after being twisted and left to dry, becomes full of creases and restricts your movement. These adhesions or trigger points in the fascia can pull on surrounding structures, including the joints, creating constant tension that is often interpreted by our brain as joint pain. This is why, often, the pain we feel in our knee may originate from the stiffness of the fascia in our thigh, or shoulder pain may be linked to tension in the neck and chest. Traditional stretching is often not enough to release these deep restrictions. It stretches the muscle, but doesn't necessarily unstick or rehydrate this stiffened fascia. What we need is a smarter approach that works not just with the tissue, but with the nervous system that controls it. What if there was a way to send a direct signal to the brain to authorize deep relaxation of this tissue? This signal to the brain is at the core of the scientific mechanism we are about to unravel. The technique behind the forgotten stretch is not just a mechanical act of stretching a muscle. It's a dialogue with our neuromuscular system. To understand this, we need to talk about proprioceptors. Within our muscles and tendons, there are tiny sensors called proprioceptors. They are the body's informants, constantly sending data to the brain about the position, length, and tension of each muscle. Two of these sensors are crucial here: muscle spindles and Golgi tendon organs. Muscle spindles, when a muscle is stretched quickly, fire an alarm to the brain, which responds with a reflex contraction to protect the muscle from overstretching. This is why, when you try to force a stretch, you feel that resistance, that break. On the other hand, the Golgi tendon organ monitors tension. When the tension in a muscle becomes too high, it sends a signal to the brain that says, "Hey, the load is too heavy. We need to relax to avoid injury." The brain then responds by inhibiting muscle contraction, allowing the muscle to lengthen. The technique we will learn utilizes exactly this protective mechanism to our advantage. It intelligently manipulates these signals to achieve a much deeper and safer relaxation than conventional static stretching. Instead of fighting the body's protective reflex, we safely trick it, causing the brain to permit the fascia and muscle to release. The technique we are discussing has a name, and it's not new, but rather forgotten by the general public. Despite being widely used by physiotherapists and elite athletes for decades, we are talking about proprioceptive neuromuscular facilitation, or PNF. The name might sound complicated, but the concept is surprisingly simple and ingenious. The most common form of PNF, known as contract relax, involves 3 basic steps. First, you take the limb to the point of a slight stretch, without forcing it. Second, and here's the secret, you isometrically contract the muscle being stretched against resistance. It can be your own hand, a wall, or a partner's help for about 5 to 10 seconds. This contraction increases tension in the muscle, intensely activating the Golgi tendon organ, that sensor we talked about. Third, you completely relax the contraction. At this exact moment, the Golgi tendon organ sends that inhibitory signal to the brain, creating a window of opportunity of a few seconds in which the muscle's contraction reflex is suppressed. It is in this window that you gently advance the stretch, gaining significantly more range of motion than you could before, and much more safely. This method not only stretches muscle fibers, but also helps release adhesions in the fascia, promoting almost immediate relief from that stiff feeling that translates into joint pain. It's the science of the nervous system applied to movement. Now, it's crucial to be honest and clear about the evidence. The promise of erasing pain is strong, and we need to understand what science actually says. PNF is one of the most studied techniques in the field of rehabilitation and flexibility. A meta-analysis, published in the Journal of Human Kinetics, reviewed several studies and concluded that PNF is consistently superior to static stretching for acute gains in range of motion. Another study, in the Scandinavian Journal of Medicine and Science in Sports, demonstrated that PNF not only improves passive flexibility, but also muscle strength. The evidence that PNF increases flexibility is robust. But what about pain? The link is indirect, yet powerful. Joint pain, especially in people over 50, often doesn't come from the joint itself, but from the compression and stress caused by shortened muscles and fascia around it. By restoring the flexibility and normal length of these tissues with PNF, you relieve this pressure, which leads to a significant reduction in pain. However, it's essential to understand the limitations. PNF will not cure arthritis, regenerate cartilage, or fix serious structural problems. It is an extremely effective tool for pain of myofascial origin and stiffness. The 5-minute relief is real for many people, but it may not be the case for everyone, and consistency is what will bring lasting results. Would you like to know if you've heard of this technique before? Leave your experience or questions in the comments below. Your interaction greatly helps our channel grow. Let's now move on to the practical part. How to apply PNF safely and effectively at home. We'll start with one of the most problematic areas for those who sit for long periods. The hip flexors. Shortened muscles here can cause lower back and hip pain. First, find a comfortable spot, perhaps with a yoga mat or carpet. Kneel with one leg forward, forming a 90-degree angle at the knee, as if proposing. The other leg is behind, with the knee resting on the floor. Keep your back straight and your abdomen engaged to protect your lower back. Gently lean your body forward until you feel a slight stretch in the front of your thigh of the back leg. This is your starting point. Now, the magic of PNF. Step 1. The contraction. Press the knee of your back leg against the floor, as if trying to drag it forward. You will feel the thigh muscle contract firmly. Hold this contraction for 6 to 8 seconds. Breathe normally. Don't hold your breath. Step 2. The relaxation. After 8 seconds, completely relax this contraction. Take a deep breath and exhale. Step 3. The new stretch. Immediately after relaxing, take advantage of the window of opportunity and lean your body a little further forward, deepening the stretch. You will notice that you can go much further than before, without pain. Hold this new position for 20 to 30 seconds, breathing deeply. Repeat this contract-relax cycle 2 to 3 times for each leg. The key is gentleness. Never force the movement to the point of sharp pain. Another joint that frequently causes us problems is the shoulder. Shoulder stiffness can limit simple activities like reaching for an object on a high shelf or even putting on a shirt. We will apply the same PNF principle to shoulder rotation, a critical area for mobility. For this exercise, you can stand or sit. Lift your right arm out to the side, bending your elbow at a 90-degree angle, so your hand points to the ceiling, like a stop sign. This is the external rotation position. Now, use your left hand to hold your right wrist. Step 1. The contraction. With your right hand, try to move your arm downwards. Bring in your hand towards the floor, but use your left hand to completely prevent this movement. You will feel the muscles in your shoulder and back contract. Hold this isometric contraction for 6 to 8 seconds, remembering to breathe. It's not a strength battle, just a firm contraction. Step 2. The relaxation. Completely relax the contraction of your right arm. Exhale fully. Step 3. The new stretch. As soon as you relax, use your left hand to gently push your right hand a little further back, deepening the external rotation of the shoulder. Only go to a comfortable stretching point, never to pain. Hold for 20 to 30 seconds. You can repeat the cycle 2 to 3 times and then switch sides. This exercise is fantastic for releasing tension in the shoulder joint capsule, improving mobility, and alleviating that uncomfortable pain. Remember, consistency is more important than intensity. Performing this 5-minute stretch can bring immediate relief, but to transform this relief into lasting improvement, integration and consistency are fundamental. Think of this technique not as a remedy to be used only during a pain crisis, but as daily hygiene for your joints, just like brushing your teeth is for your oral health. The ideal is to incorporate PNF into your routine, perhaps in the morning to start the day with more mobility, or at night to release accumulated tension. An important tip is to always perform a brief warm-up before starting the stretches. 5 minutes of walking in place, or gentle circular movements with your arms and legs, are enough to increase blood flow to the muscles, making them more receptive to stretching and reducing the risk of injury. The recommended frequency for PNF is 3 to 5 times per week. More than that may not bring additional benefits and could even overload the tissues. Listen to your body. If you feel any sharp pain or discomfort that doesn't seem normal for a stretch, stop immediately. The beauty of PNF is that it teaches you to have greater body awareness, to understand the signals your body sends. Over time, you will learn to distinguish between the productive discomfort of a tissue releasing and the warning sign of harmful pain. This regular practice will not only alleviate pain, but also improve your posture, your range of motion, and consequently, your independence and quality of life. To conclude our journey today, it is absolutely essential to reinforce a critical point. The information and techniques shared in this video are for educational and wellness purposes, based on solid scientific research. However, they do not, in any way, substitute for the evaluation and guidance of a qualified healthcare professional. Before starting this or any other exercise program, especially if you have a history of injuries, surgeries, intense chronic pain, or medical conditions such as rheumatoid arthritis or osteoporosis, it is imperative that you consult your doctor or a physical therapist. They will be able to assess your specific condition and ensure that this technique is safe and appropriate for you. What we have learned today is that joint pain is not a sentence, and often its cause lies in the stiffness of the soft tissues that the science of PNF can help resolve. We have seen the mechanism behind neuromuscular relaxation, the evidence supporting its effectiveness, and most importantly, how to apply it practically and safely. This forgotten stretch is a powerful tool in your self-care arsenal, a way to dialogue with your body and restore freedom of movement. If this video was useful to you, consider sharing it with a friend or family member who might also benefit from this information. And, of course, if you haven't already, subscribe to the channel for more science-based content for a healthier, pain-free life. Take care and see you next time.